Every surgery starts long before the first incision is made. It begins with the consent. Hi, today I am here with a different topic. Usually I post surgical videos on this channel, but today I intended to post about consent, which we must all obtain before surgery or any other procedure. Is the consent we take today truly informed, or is it just another piece of paper filled with some generic words and medical jargon? How do you usually obtain consent? And what aspects you consider when obtaining consent? Have you ever thought about the need to create consent for an even the most complex or rare procedures within seconds? An informed consent is not just a legal formality, it is the bridge between doctor and patient, a conversation that ensures understanding, trust, and shared decision making. Unfortunately, most traditional consent forms are medically weak and impersonal. They often use generic templates, the same document for every patient, regardless of their unique medical history or risk factors. This can be used for all sorts of procedures irrespective of the specialty. Essentially, anybody can create consent like this within a few seconds. I have often heard doctors in group worry that AI will take their jobs, but that's not the right way to look at it. AI can actually make our work easier, more precise, and smarter. I don't think we could create such perfect consent form using the old templates. So I personally believe AI will make our work easier, more accurate. We might have done thousands of surgeries, but luckily we haven't encountered any complications. But remember, every case we handle is a new one, not like the old ones. So we should always anticipate potential complications for each case. And one day, a patient might point a finger at us. The only prevention for that is to have a good, valued, informed consent in our hands. Usually, we see a blanket consent being used in many hospitals. For any procedures, it covers common things like bleeding, infection, adjacent organ injury, and complications due to anesthesia like that. But that is not the right way to take consent. Consent should be tailor made, patient specific, and disease specific. Only such consents are legally valid. Imagine we have three patients. The first patient is a 25 years old young patient who came in for a laparoscopic cholecystectomy, and another patient, a 65 years old male, has some cardiac issue and is on dual antiplatelet therapy, and the third patient, a 40 years old female, had a previous history of right-sided pyeloplasty surgery. So, if these patients are undergoing laparoscopic cholecystectomy, do you obtain consent for all three patients in the same way? If you are obtaining consent in the same way for all three, it is not a proper consent because each person will have a different potential issues. The first patient is okay, it could be a normal cholecystectomy, but the patient on dual antiplatelet therapy may have a bleeding risk during and after surgery, and the third patient may have adhesions, so they might need extensive adhesive lysis, which create different problems. So you need to take a tailored patient specific consent for every patient. A blanket consent form won't hold up in court, it is unsafe and legally vulnerable. Taking a good legally valid consent not only protects you but also enhances your impression on patients. They realize you have addressed all their problems. Nowadays, patients are smart, so for the surgery we suggest they will either get a second opinion or they will Google it or search on some AI platform. So the fact that they get the same information we gave them will further increase the patient's trust in us. Now let us see how we can use AI to create a consent form. You can use any AI platforms, ChatGPT, Gemini, Grok, DeepSeek, whichever you prefer. Today I will show you how to create a consent form using ChatGPT. You can either use free version or the paid version. In my short-term experience, ChatGPT performs better, which is why I personally prefer it. I am using the paid version here, but you can use the free version. It will also work similarly for this purpose. Let's take an example. Suppose we have a patient. We start by entering basic details such as patient ID, patient's name, age, sex, presenting complaints. For example, here is a 67 years old male presented with right upper abdominal pain for the past 4 days. Next, we include any comorbidities. In this case, type 2 diabetes mellitus, systemic hypertension, coronary artery disease on dual antiplatelet therapy. And we mentioned the diagnosis as acute calculus cholecystitis, and the procedure name is laparoscopic cholecystectomy. Then we give a prompt like this: kindly prepare an informed consent document for this patient incorporating a detailed list of potential complications along with their incidence rate in bracket in percentage as documented in standard peer-reviewed medical journals. So this is the basic information you provide to AA. Then we simply ask it to create a consent form for us. You enter the details. Within seconds, the consent form is generated. It is really simple as that. Or alternatively, you can include in your prompt, convert it into a printable document. Then the AI will generate a consent in a clean printable format, ready to download as a PDF or Word file. You don't even need to create a prompt file. You can simply talk to the AI and it will create it for you. In just a few clicks, you have a personalized, detailed and legally strong consent form is ready, something that used to take hours or rely on generic templates. But the wonders of AI don't end here. So far we have generated the consent form in English, but remember, consent should be always in a language that the patient and their relatives can clearly understand. With AI, that is incredibly easy. You can simply ask to translate the entire consent into any local language. For example, here I have asked it to translate the consent into Malayalam, and within seconds the whole document is ready in Malayalam. And in our hospital we also have many guest workers, so we often need consent in Hindi or Bengali. Again, just online in prompt and see it is translating the document into Hindi right now instantly. Our hospital also receives a lot of foreign patients, especially from various Arabian countries. So I can simply ask the AI to translate into Arabic, and within seconds the entire consent is perfectly converted into Arabic. What used to take hours, finding a translator, checking accuracy and formation, now takes just a few seconds. So that is the beauty of AI. If you are using an EMR system in your OPD, you can easily generate personalized consent form using AI tools like ChatGPT. Here you can see I have selected a patient from EMR. All the relevant clinical data are displayed. The diagnosis is acute appendicitis, and his chief complaints include abdominal pain, vomiting, fever. And you can also view the investigation reports such as ultrasound finding and abdominal examination notes, and the proposed procedure here is laparoscopic appendectomy. Now all you need to do is copy the patient data including the name, UHID, age, sex, and paste it into ChatGPT. Next, simply type a prompt like prepare a surgical consent form in Malayalam. Within a few seconds, ChatGPT will generate a professionally worded patient-specific consent document in Malayalam. If you have a printer connected, you can print the consent form immediately and keep it ready for signature. This is just one example how you can create a personalized consent using AI. But that's not all. You can also generate discharge summaries, reference letters, and operation notes within seconds. And you can also easily manage your OPDs, and all this beyond the scope of this video we can discuss in another occasion. Thank you so much for watching.